somebody gets ill with a contagious disease such as measles, polio, or whooping cough, this could be the first case of an epidemic. After the first case, the disease spreads among people who are not protected by vaccines. Many people fall ill. Doctors report cases to public health officials who record all cases and create an epidemiological curve. The curve shows the number of disease cases per week. Disease epidemics occur all across the country. In every state, the number of cases per week is recorded and can be plotted on an epidemiological curve. Each state may have a slightly different pattern, but without vaccines, epidemics can be widespread. Data from all states are compiled centrally in computer and paper archives at the federal level. Project Tycho digitized these data for the past 125 years for easy access and analysis. For example, the number of cases can also be represented by color coding. Blue indicates a low number of cases, and red means a high number of cases. Each color bar represents an epidemiological curve for a different state. For many diseases, epidemics occur every year in the absence of vaccination. Sometimes the epidemic is large, sometimes very small. It can also happen early in the year and sometimes late. The epidemiological curves for multiple years can also be represented by color coding, and each state will have its own long-term color-coded disease pattern. The color-coded disease patterns for each state can be stacked together to compare patterns across states and across years. If remarkable patterns occur in a particular state or time period, these can be easily found in this display. Also, many years can be shown in one graph, and yearly epidemics remain visible by color coding. This graph shows epidemics for each state for many years, from 1928 through 2002. Before vaccine licensure, epidemics would recur every year in all states. After vaccine licensure, the number of cases greatly reduced, as most people were protected from the disease due to the vaccine. The shift in color on the graph from green-red before 1963 to dark blue afterwards indicates the change from high to low cases across all states after vaccine licensure. These displays can help public health officials to improve programs and fight diseases. Using Project Tycho, Pitt public health scientists found that 100 million cases of contagious disease were prevented in the United States during the last century. Project Tycho data are free for everybody to use. Are you interested in diseases in your own state or want to do your own analysis? Access Project Tycho at www.tycho.pitt.edu.